I'm here to discuss exercise and its role in assisting men with prostate cancer. I'll also introduce you to Proactive, an exercise group I started to support men with prostate cancer. Supporting men with prostate cancer has been a labour of love for me. I'd like to thank the Prostate Cancer Foundation for the invitation to speak. I'm not a natural public speaker, so this is a little scary for me, but I didn't want to miss the opportunity. As with yesterday, this slide, picture on the slide is me completing Ironman in 2014. It has absolutely nothing to do with prostate cancer. It's just there to remind me that I'm brave and that I can get through this. So my job title is Urology-Oncology Coordinator. I coordinate care and support people with urology cancers. So that covers kidney, bladder, prostate, penis and testicular cancers. The ongoing support of men with prostate cancer has become an area I'm particularly passionate about. My job didn't exist before I came into it. I had to invent the role, which meant I was able to see where the deficits were and try to fill them. I spent the first few months sitting in with doctors, listening to them interact with patients. This was a hugely valuable experience. I was able to see different communication styles and was able to observe how people receive information, both good and bad. Most importantly, I saw what wasn't being communicated. I realised my most important role was filling in the gaps for both the doctor and the patient, explaining to patients what the doctor was discussing or explaining the process and what to expect, explaining to doctors what the patient was really thinking but couldn't express. I noticed that what men were saying to the urologist was often quite different to what they would say to me. And the doctor would give all the necessary information, but the patient would only absorb a small amount of that. Through fear or anxiety, the questions would come long after the urologist had left the room, and this can be weeks or days. I learned that because men are natural problem solvers, their instinct is to focus on practical matters, like how soon can I have my operation? How long do I need off work? Often they are unable to process information regarding the risks and side effects of treatment until after the treatment is finished. After a diagnosis of cancer is given, it is well documented that a very small amount of other information is absorbed, something in the order of 20%. 14 to 23% of men regret having their prostate cancer treated, or the treatment choices that they made. Regret is related to quality of life issues. Bowel irritation and sexual problems were the most common complaints, and incontinence the close second. The level of regret increases over time rather than decreases, and this is thought to be due to the initial concerns over survival and the realisation of quality of life issues coming long after the initial fear subsides. So it's essential that much emphasis be put on the pre-treatment education and communication to reduce these statistics, and a robust support network be available post-treatment to deal with quality of life issues. I did some further research and I found some frightening statistics. Men with prostate cancer have double the rate of depression as other adult men. They are 2 to 4 times more likely to be suicidal than other adult men. 10 to 40% of men with prostate cancer are distressed. 50% of prostate cancer survivors report unmet psychological needs. Yet, men are reluctant to seek psychological support. These statistics really bothered me. They were impossible for me to ignore. We are doing a really fabulous job of curing and/or treating prostate cancer, and rather than a death sentence, it is fast becoming more like a chronic disease. But we're leaving men damaged, and the side effects of our treatments are life-changing. I also came across a website called Exercise is Medicine. It's a movement of professionals committed to spreading the word about the benefits of exercise for health, and they offer free printable fact sheets. There was one for prostate cancer, and there were 2 quotes on that really took my attention. Established scientific evidence shows that regular and vigorous physical exercise prevents some cancers and can also reduce the incidence of cancer by 30 to 70%. And the second one, in regards to the management of prostate cancer, they say There is now irrefutable evidence from large prospective studies that regular exercise after cancer diagnosis will actually increase cancer survival rates by 50 to 60%, with the strongest effect being for breast, colorectal and prostate cancer. A recent study has reported a 49% reduction in deaths from all causes in patients with prostate cancer who did more than 3 hours of weekly vigorous activity, and 61% lower risk of prostate cancer death. I read that and I just thought, wow, why is no one talking about this? So I was motivated to see more support available to help men cope with the problems we were creating with our treatments. That led me to discover that there was already a men's cancer support group run out of our local cancer society. So I got some flyers and set out to discuss the support group with my patients. But I just couldn't get anyone to go. I tried and tried to get them to go, but they just wouldn't. It became apparent to me that men just don't like support groups. In fact, one man said to me, "What would we do? Sit around and sing Kumbaya?" It was frustrating, and actually it started to get uncomfortable just mentioning it. According to Albert Einstein, the definition of insanity is doing the same thing over and over again and expecting different results. So I needed to do things differently. So I had an idea. We needed a support group that didn't look like one. Maybe I could get men to start their own support group by inviting them to an exercise group. I wanted to harness all the positive effects of exercise and in doing so provide a support group that didn't present as one. Genius. Group exercise. So what do men want supportive care to look like? Associate Professor Prue Cormy, an exercise physiologist from Melbourne, Australia, has done research answering exactly that question. She asked men what they believed to be important masculine values. Their list was control, resilience, strength, independence, self-reliance. All of these values are the sorts of values that might stop somebody going to a support group, but all of them are values that exercise speaks to. When asked what they would like to see in a support group, they listed casual, humour, positive, camaraderie, and to be active. Men don't want to sit around singing Kumbaya. They want to do things together, beside each other. They want to have a laugh. They like to know they can talk if they want to, but don't have to if they don't want to. Just knowing they're not the only one, they're not alone, it's enormous. So Proactive was born. These are the men from our first intake. They all have prostate cancer, all of them with differing stories and experiences, but they all have something to offer each other in terms of support, and they all rave about the positive effects of both the exercise as well as the support. We take any men with prostate cancer. In fact, we've actually opened it up to men with any cancer. Some are pre-surgery. We encourage weight loss pre-surgery to assist with reducing side effects such as continence. Some are post-surgery, and some have had radiation. Many are having androgen deprivation, and some are on active surveillance, so haven't had any treatment at all. Some men come for the physical exercise, and they get that, but with a side helping of social support. Some come for the social support, and they will get a side helping of exercise. So it's a win-win, for me anyway. So how did I make it happen? I talked about it a lot, and I approached Annika Carlson from Studio Vigour. She's a personal trainer that lives locally. She's dynamic and motivated, and I knew she had an interest in cancer. She was also an ex-police officer, so I sensed she could handle the banter of a bunch of blokes. Meg Rodell from the Cancer Society was very interested. She instantly understood the concept and was really keen to help. So the Cancer Society offered to fund a 16-week trial. The Cancer Society were perfect because they're a trusted brand, they're accessible nationwide, their focus is supporting people living with cancer, and they already had an existing support group. This was the first Proactive workout. It was a lovely sunny day down on the coastal walkway in New Plymouth, right in the centre of town. And the trainer texted that to me, and I just about cried when I saw it. And here they are again on the coastal walkway. They do all sorts of things, wall sits, work with the flex bands. You can see them interacting with a bunch of ladies that walked past. And they also go to other locations such as Pukekura Park, the Bowler Brooklands. They go down to Back Beach, and if anybody knows New Plymouth, you'll know the stairs at Back Beach. There's a couple of hundred of them, and they're really hard, and they do that. And when the weather's not so great, they do Pilates in the studio. So the evidence for exercise is building every day. Their first reported link was in 1922. From 1922 to 2009, there were a few hundred studies done. From 2009 to 2018, there are literally thousands. Strong evidence now exists that exercise limits the treatment side effects and improves quality of life outcomes for cancer patients, and mounting evidence that it may also alter disease progression. So potentially we could slow progression and reduce risk of recurrence for some men through exercise. There's in fact so much research that it was really hard to condense this talk into half an hour.
Our bodies are making potential cancer cells all the time, but our immune system regularly finds them and destroys them. Crucial to our tumour defence force are so-called natural killer cells. They're one of the only cell types that can recognise threats generated by our own bodies and call in an attack. It's one of life's great mysteries why some cells slip past our defences and begin to grow. So our own immune system is still one of the best ways to fight the cancer. The trouble with chemo is, at the same time as it's poisoning our tumour cells, it's also wrecking our immune system. Which brings us to a small but remarkable study conducted in Sweden and published in 2013. A group of 10 average healthy young men were exercised on a bike for 60 minutes. Their blood was taken before the exercise and also straight after. The before and after bloods were then spun down to extract the clear serum and poured over laboratory lines of prostate cancer cells to see if they would grow. Incredibly, the serum taken straight after exercise suppressed the cancer cell growth by 30%.
That particular study is landmark because what it has done is it's woken up the scientific community to say there is something produced during exercise systemically. So the muscles are producing chemicals which are going to all parts of the body and they're actually destroying tumour cells.
So that's pretty exciting. And obviously still needs a lot of research, but pretty exciting all the same. That was just there in case that hadn't worked, so we'll skip that. Active surveillance. I found this great quote a long time ago. I don't even know where I found it, but I wrote it down at the time. Prostate cancer, a common curable cancer that commonly doesn't need to be cured, which is very true. So active surveillance is where low-grade, low-risk prostate cancer is found, and we often opt not to treat this or to delay treatment. The goals of active surveillance are to reduce over-treatment. Many men will die with prostate cancer and not of prostate cancer and never need to be treated. And the idea of active surveillance is to find these men and monitor them to identify disease progression so that we can treat the ones that need to be treated. And possibly just to delay active treatment and delay the resulting side effects of treatment. So if exercise can slow the growth of cancer cells by 30%, what are the possibilities for active surveillance? Could this mean fewer men progressing to active treatment? Could it mean avoiding the side effects for a lot longer or altogether? And could it reduce the cost to healthcare. Androgen deprivation therapy is the suppression of testosterone. This is the injections, the Zoladex and such. We give it to remove the cancer's fuel supply, leading to an array of unwanted side effects. In my opinion, this is the area that exercise can make the most change for our patients. The side effects of ADT are quite emasculinizing. You've got weight gain, can get emotional, losing strength, losing libido, fatigue, hot flushes. All of these things lead to distress and potentially depression. Men with advanced disease are on ADT for life. When you look at the side effects, they are all things that exercise has been shown to assist, all of them. Increased body mass, fat, decreased muscle mass, decreased bone density, fatigue, decreased libido, increased risk of other disorders, increased psychological distress and emotional and mood swings. All of those things can be treated at least in part by exercise. Cancer-related fatigue. This is common in all cancers, but for men on ADT it's a double whammy. They have cancer and they also are taking medication that makes them tired. And people historically have been told to rest when they have cancer or when they have fatigue. Cancer-related fatigue is highly prevalent in all cancers and often reported as the most distressing side effect. And you get tired, so you rest. You become weak, your fitness decreases, you become deconditioned, you're able to do less, you rest more, you get more deconditioned, more fatigued, and so it goes on. But exercise, sometimes you have to expend energy to gain energy. So exercise is very well known to help with cancer-related fatigue. This here is a study which reviewed all of the research available at the time on exercise for cancer-related fatigue. It's a forest graph. So each of the dots on the graph represent a different study. The line up the middle is kind of like a neutral line. Any of the dots that are to the right of the line means that the outcome of the research favoured exercise. Anything on the left-hand side of the line did not favour exercise. And I could only count 2 studies that were on the left of that line, so that's really very convincing. This is a study where Galvao and his colleagues looked at the muscle loss for men on androgen deprivation and compared men who followed an exercise regime and the control group were given no exercise advice at all. You can see here the men who exercised are shown in blue, and you can see that they gained muscle mass, and the non-exercising group all lost muscle mass. And this was over a 3-month period. This was a similar study by Prue-Cormy. The graph shows improvements in muscular strength, cardiorespiratory fitness, mental health and social functioning. You can see that the sexual functioning still declined in both groups, but the exercising group's decline was significantly less. Up to 90% of men with prostate cancer experience sexual dysfunction to some degree. Approximately 50% of men with prostate cancer report unmet sexual needs. Sexual health is well documented as the area with the most unmet needs and a source of anxiety for many. This study shows that exercise can improve or at least maintain sexual activity and libido. The blue lines represent the exercising men and the grey lines the men who weren't given any exercise advice. So the exercise recommendation. They suggest aerobic exercise 20 to 60 minutes 3 to 5 times a week, and that should be at 60 to 90% of the maximum heart rate. Resistance or weight training 2 or more times a week. This should mimic functional movements that mimic tasks of daily living, getting up and down out of a chair, shoulder press so that you can reach high objects, flexibility exercises to reduce the risk of falls, which is particularly important when you have a lowered bone mass. Generally, these are recommendations. Obviously, any exercise is better than none, and this is a significant amount of exercise for anybody these days. So it's a goal. Obviously, to get the best overall results, this is ideal. So what are we trying to achieve? We want to overcome or reduce side effects of treatment, regain muscle mass and strength. Decreased muscle conditioning increases the risk of falls, and it's bad when you also have weak bones. Improve general health. People with cancer can be at increased risk of developing comorbid conditions, such as metabolic syndrome, cardiovascular disease, diabetes, and osteoporosis. A consequence of this is increased morbidity and reduced quality of life. We want them to overcome fatigue, improve stamina, slow the growth of cancer cells, maybe reduce risk of recurrence, improve quality of life and body image, improve sleep, it's the best known treatment for depression, and increase the immune capacity. And as it showed in the video, enhancing the immune capacity is thought to be the most likely mechanism for increased survival through exercise. And the social support, I missed that one. And that's what the coffee's all about. As I had hoped would happen, the proactive men arrange their own coffee group at the end of every workout. Even when the men are unable to join the exercise group because of injury or other commitments, they often still turn up for the coffee. They have 2 cafes that they go to, and they seem to have their own fan club at each of them, with the ladies that serve them and enjoy their cheek. The wonderful thing that I didn't expect is that the men actually include their wives in their group. They have regular group dinners out together with the wives, so the wives have gained a support group as well. They've entered a team into the Relay for Life for the last 2 years, and we are together planning an event for Blue September. The camaraderie and mateship has completely blown me away. It was what I had hoped for, but has totally exceeded all of our expectations. So some feedback from the men. I've been a dancer all my life, and the exercises have been developed especially to keep me dancing for as long as I can. This was actually a man I met in Melbourne when I was visiting the Deakin University looking at their research on exercise. This man he had advanced prostate cancer and he was on ADT, and I just include it because it's a great example of helping someone continue to live their life on their terms, doing the things that are important to them and that gives them pleasure. It gives me a purpose when I get out of bed in the morning, makes me more motivated all day. Lots of men comment that they have lists of things to get done that they just don't get to. On the days they come to Proactive, they come home and they often get started on their list and get things done. It got me off the chair after having depression. It's about doing something about it for yourself. This man was spending all his time at home, barely leaving the house. He was suffering from depression. He was tricked into attending the information evening, for which he was really annoyed. He is now one of the biggest advocates for the group and really misses a session. I've received an email from his wife thanking me for giving her husband back. Meeting other guys in the same boat. You know you're not the only one. You know your situation is not unique. It just normalises having cancer, and it also helps men to accept the side effects. So Cancer Society have continued supporting us, and they continue to support a 16-week free for men. But it had always worried me about what would happen after the 16 weeks have finished. Would they be able to stay motivated? Would they keep in contact? Would they keep supporting each other? So what we've done is, when the 16 weeks is over, we're now able to offer the men a membership to Rampage Fitness, a local gym in New Plymouth, and they get their membership for $10 a week. And for that, they're able to use all of the services that the gym offers. Their visits are unlimited. It's 24 hours a day. This has been really successful, and almost all of the men have taken up the offer. They still meet there at the same time. They work out together and they still have coffee afterwards. They often meet with the current Proactive men who are on their 16 weeks free. So the group continues to grow. So making it happen wasn't easy. So what were the tricky bits? Equity. It would be perfect if this was available to everyone. Until we have similar groups around the country, this isn't possible. It is ideal if your postcode is not the limiting factor to accessing support. We were very conscious that in New Plymouth our group was not accessible to men living in more rural areas like South Taranaki, Uranui or coastal areas. We are very soon starting a second men's group in South Taranaki, but we're also very conscious about our second sessions not accommodating men who still work. This remains a problem. Free or low cost. This is a similar problem, really. It was my vision for this to be provided free of charge. I felt that charging a fee makes it exclusive to those that can afford it and immediately excludes those that can't. And given the difficulty with recruitment, being a free service obviously is a much easier sell. Recruitment. It's difficult. It's still difficult. Men just don't like the idea. But if you can get them to turn up, they see the benefits and they never leave. There have been times I've stayed after work and spent 3 hours calling men and have only managed to recruit 2 or 3. Now that it's established, it's slightly easier because the men help me to recruit others and they're out in public and people see what we're doing. We're currently working on getting some promotional material developed and printed. The trainer. The trainer is really important. It's ideal for the trainer to be a trained professional. In Australia, they use exercise physiologists. They're hard to come by in New Zealand, and the ones that we have tend to work in high-performance sport. Physios are ideal. Our South Taranaki trainer will be a physio. But even then, choosing the trainer is still important. They must be easygoing. The conversation can go anywhere, and we want to encourage that. They must handle the cheek and banter. They must understand the concept. This is as much a social support group as it is an exercise group. They need to motivate, but still be light-hearted and fun. They must understand that the most important measurable outcome is improvement in quality of life and well-being. It needs to be sustainable. How do we keep it going and keep it growing? Where will the funds come from? If it's free for the patient, then who's paying? I've been really lucky with the Cancer Society's ongoing support, and I'm unsure if other people around the country will be as lucky. I'm really hopeful it will go to all cancer societies, but we'll have to wait and see. And the message, basically, the concept. We have to sell it about quality of life and wellness. It's not about weight loss and fitness. It's got nothing to do with the way you look. And I think the fitness industry has made exercise about the way you look. And we need to look past that and make it about quality of life and wellness. And you know, the health stuff comes with it, obviously, but we need to sell it as quality of life and wellness. And the positive benefits for your health are the byproducts, not the goal, at least when we're selling it anyway. So Proactive is about improving quality of life, well-being, and living well in spite of cancer. This is my overarching goal, to help men live their best lives in spite of cancer. With good education and appropriate support, it is possible to improve people's lives and potentially their cancer outcomes as well. And that's me.